Welcome. My name is Dr. Chris Morosky, and I am the March of Dimes Connecticut Market Board Chair. The March of Dimes leads the fight for the health of all moms and babies. We are facing an urgent maternal and child health crisis that has only been intensified by the COVID-19 pandemic. In the United States, every year, approximately 700 women die from complications of pregnancy or childbirth. That's the equivalent of one mother dying every 12 hours. Let that settle in a little. And for every maternal death, there are approximately 100 cases of severe, life-threatening complications that affect approximately 50,000 women every single year. These numbers are disproportionately high for moms and babies of color. Black women in the United States are 3 to 4 times more likely to die from pregnancy complications compared to white women, and their children can face a 130% infant death rate. The March of Dimes works in communities everywhere to reduce the rising rate of preterm birth, as well as maternal morbidity and infant mortality. It supports families before, during, and after pregnancy to ensure that all moms and babies get the best possible start. We're here tonight to make an impact for all families, and we thank you for joining us. Now please join me in welcoming Stacy Stewart, the President and CEO of the March of Dimes.
Welcome and thank you for coming together in support of moms and babies when they need us the most. How we connect at our events may look different during COVID-19 pandemic, but our shared commitment to giving all families the best possible start is as strong as ever. As you know, the United States is among the most dangerous developed nations in the world in which to give birth. And that's under the best of circumstances. Thanks to your support, we're able to continue fighting the serious maternal and infant health issues that affect our communities. We can be there for every family, those who've had their firsthand hardships, those celebrating their health, and those just trying to start their families. So get ready to have some great experiences at our now virtual events and see how our mission works to improve the health of moms, babies, and their families in your community and everywhere. Thank you and enjoy.
I'd like to echo Stacy's sentiments as well as Dr. Morosky's welcome. I'm Renee Danino, honored to join you tonight as your MC to raise important funds to support March of Dimes. Throughout our time together tonight, we'd like you to chat with us and with each other in the chat box. Well, why don't we warm up that chat box now with a virtual networking chat of sorts. Share greetings, who you are, and where you're from. Thank you. It's great to see folks here tonight from all over our beautiful state. Bloomfield, Hartford, Westport, Glastonbury, Manchester, Fairfield, and also from Boston and Springfield, Massachusetts. Now let's see a show of virtual hands to those that have registered for the online auction. For those of you that have not yet registered, please click on the thermometer to register your info and to get a look at all the terrific curated items. It will only take a few moments. Remember, funds raised is all for a great cause. Also, the auction will close at 9 p.m., so bid frequently and high. And after the event, you'll be notified if you won the winning bid or not. Signature Chefs represents one of the premier opportunities to support March of Dimes for guests and for sponsors. We would like to introduce you to our gold sponsor, Tito's Handmade Vodka.
Tito was already doing it on his own before we put a name on Love Tito's.
He used to give it away, which of course included charitable events.
Tito allows each of the employees to choose what charity in their local community they want to give back to.
I think that's the end goal, is to do something that has meaning and purpose.
We're here in this company to make the world a better place, and we like to think we're doing it through Tito's Handmade Vodka.
We would also like to thank the Crane Fund for their gold sponsorship. Now, before I introduce you to the chairs of this event, I would like to commend the Connecticut Market Board for their service and commitment to the mission. They have demonstrated that commitment with 100% giving participation. When board members give at 100%, they are making a proud statement to the community. They're saying, we stand behind this organization, every single one of us. We believe in the mission and we proudly support it financially. We are leading the charge in our community, owning and spearheading the work of this wonderful nonprofit. Now, I'd like to introduce you to the chairs of this event, Andrea Mascaro and Julissa Velasquez. Please welcome.
Thank you, Renee. The March of Dimes is fighting to improve the health of families, just as they've done for the past 80 years. As Dr. Murawski mentioned earlier, our country faces an urgent maternal and child health crisis. The stark reality is that the U.S. is among the most dangerous developed nations for childbirth. In the midst of the COVID-19 global pandemic, March of Dimes is focused on the health of families who we know may be at even greater risk. Families need us, always, and March of Dimes community has stepped up to be there for them throughout the crisis. 2020 is a year like no other. Your support is needed now more than ever. I would like to shift to recognize several key volunteers for dedicating their time, talent, and treasure to support this event and the March of Dimes as a whole. Let's give them all a virtual round of applause.
What's up, y'all? Come on in for a cocktail. My name is Christina Crane. I am the Senior Texas Sales Coordinator at Tito's Handmade Vodka. Today I'll be showing you how to make one of my favorite cocktails, a strawberry jalapeno Tito Rita. We're gonna start by putting a rim on the glass. I like spicy, so I have a spicy salt mixture here. Just gonna take this lime wedge, run it around, dunk that in the spicy salt. I'm gonna grab my shaker tin and start with a little muddling. Add enough strawberry slices to make about 1 full strawberry. A couple jalapenos to fit your spice preference. Muddle those guys, squish them up a little bit, and then add some ice. We'll grab the Tito's Handmade Vodka for 2 ounces. We will do 1 ounce of orange liqueur, 1 ounce of lime juice, a little squeeze of simple. Shake this guy up. Dump that bad boy just like a bad boyfriend. And just to make it look pretty, I'm going to take a little strawberry slice and a lime mule. And there you go. Cheers to your very own strawberry jalapeno Tito Rita. One of my favorite things about working for Tito's Handmade Vodka is the opportunity to be able to bring my dog to work. Having that companion by my side whenever I feel it is necessary is just really nice. The rumors are true, we have co-workers.
Sorry, did you say co-workers?
Yeah.
That sounds delicious. I would never have thought of putting strawberries and jalapenos together. I'm going to have to try that recipe. And for all of you that make a Fund the Mission contribution or bid in the auction, we will send you a copy of the recipe cards of all of Tito's fabulous cocktails shown tonight. And a huge thanks to our media sponsor, iHeartRadio, and especially to our wonderful host, Renee, for her dedication, time, and talent. Media partners and volunteers are invaluable to nonprofit organizations like March of Dimes because they help us to stay connected meaningfully with the community and increase awareness of our mission and programs. Thank you. Before I turn our program over to Renee, everyone remember the auction. Bid high and bid often. It closes at 9 p.m. I have my eye on a few items. Renee, how about you?
Thank you. Thank you, Julissa. And yes, I do have my eye on a few items. That beautiful aromatherapy necklace, for one. Now, as we've shared, Signature Chef's event is featuring an exciting new initiative launched this year called Feeding Motherhood, Meals That Matter. With each $5,000 Fund the Mission contribution, Feeding Motherhood will raise critical funds for the March of Dimes mission and enable us to support the local restaurants with the preparation and delivery of up to 25 meals that matter to moms and families, maternal and infant health care providers, NICU families, and caretakers in our community. Connecticut's restaurant and beverage industry have been feeding our mission over the years with their time, talent, and treasure. providing exquisite culinary experiences for thousands of guests. In fact, really, what would signature chefs be without, well, the chefs? Feeding Motherhood will enable us to support them by providing opportunities to support their own businesses. Tonight is also special because we want to acknowledge all of our signature chef restaurants and pay tribute to Cugino's, Salute, and Bears. Over the last 15 years, Cugino's, Salute, and Bears have been mission champions along with many other outstanding Greater Hartford restaurants, leading the charge, helping us raise over $1.2 million. Tonight, I'd like to introduce you to the owners of Cugino's, Mario Sarikovic and Janice England Sarikovic. Mario and Janice have participated in March of Dimes signature chef dinner since 2013. They do this in memory of their angel, the infant daughter they lost as a result of birth defects in April 2004. Mario and Janice opened Cugino's restaurant at Farmington in 2001. And since opening in 2001, Cugino's has become a Farmington favorite, providing guests with an upscale dining experience while making them feel like they're part of the family. Most of the cuisine is Northern Italian, while many of their daily specials are eclectic and are influenced by flavors from around the world. They offer an extensive wine list that most wine enthusiasts can appreciate. COVID-19 has affected everyone, every business, and every industry in our state, but the restaurant industry has been hit the hardest. Support our chefs. Support our restaurant industry. There are over 8,500 individual restaurants spread across Connecticut, employing more than 160,000 people. Many are small businesses, and they're struggling to stay afloat. Many haven't been so fortunate. We're urging you to partner with us to support this vital segment of this economy and through Meals That Matter with a $5,000 Fund the Mission contribution. March of Dimes has been at the forefront of providing much needed services to families during the COVID-19 pandemic, including offering many support programs virtually. The critical work March of Dimes has been able to deliver during COVID-19 is vital to making a difference for all families across the country. Now, let's watch how March of Dimes brings its mission to life.
The U.S. is among the most dangerous developed nations in the world in which to give birth, and that's during the best of times. As 2020 has shown us with the global COVID-19 health emergency, our work is more critical than ever in laying the foundation for healthy moms and strong babies. We can't give up hope. We're tackling the biggest issues head on, including maternal death, preterm birth, and the social determinants of health. Through our research, advocacy, and programmatic work, we advance toward our goal to help all 4 million babies born in the U.S. and their moms and families. We made an impact by
you're able to provide such quality care in short amount of time that's not typically allowed in the traditional setting.
So the NICU family support was super helpful. It was great to have somebody who I felt like was on our side, that wasn't just a doctor or nurse.
Hypertension and preeclampsia in the last few weeks of pregnancy is one of the biggest risk factors for maternal morbidity and mortality. With the virus and the epidemic, these patients are extremely reluctant to come in again to crowded waiting rooms. Being able to send those patients home with blood pressure cuffs where we can call them has just been tremendously helpful for us.
The initial impact has been really elevating the level of awareness and education around the problem. And we've been working hard to address the issue of infant mortality among African American women.
Whatever changes may be undertaken to our nation's health laws and systems, they must be made with the express goal of improving access to coverage and care that is accessible, comprehensive, and affordable.
We've made enough progress that we should start thinking and conceptualizing how we bring these new discoveries to the bedside so that we actually are making a difference in patient care.
The challenges for moms and babies, especially those most at risk, will not go away by themselves. Thank you for all the support over the past year. You've done so much for moms and babies. And now we need you to continue to take action with us for families today and generations to come.
Now here we are, we're at the point that defines why we're all here tonight. Our mission moment. Our sponsors and volunteers have all come together to support March of Dimes. And here's your chance to be a part of that movement. It's my pleasure to introduce a very special family. They represent the hundreds of thousands of families who know firsthand the importance of March of Dimes work. Let's hear from our 2020 Connecticut Mission family, Ariel Thorne and Marcus Hill.
My name is Ariel Thorne, and I'm from Bridgeport, Connecticut. I'm a licensed clinical social worker.
My name is Mark Hill. I'm from Bridgeport, Connecticut, and I supervise at a distribution center.
When I found out that I was pregnant with Levi, I was terrified. I did not know what to expect. There has been a history of premature children in my family. My own mother had complications when she was carrying me, and so I took every precaution to make sure that I was getting all the prenatal care. That included going to an echo appointment because when I was a child, I had a heart murmur. Up until that point, the pregnancy was easy. At that appointment, I just remember the face of the technician when she stood up and she called in other people. She told me then that I was having a high-risk pregnancy.
My first thought when I heard that he would be premature, I was scared because you don't know what to expect.
We knew that it was possible that I would have a C-section, but we didn't know that it would happen the way that it did.
The day I got the call that Levi might come early was nerve-wracking. And when I got to the hospital, the only thing I could remember was 17%. That was the chance he had to live. And a lot of women go through complications and even die during childbirth. And it's like you could lose one, you could lose two. My son's name is Levi Alexander Hill. He was born April 16, 2019, and he weighed 1 pound, 3.8 ounces.
When I had Levi, gestationally, I was 23 weeks and about 4 days.
The first time I seen my son after he was born was 20 minutes after they cut him out. And he was small, and he was in a Ziploc bag, and they had heaters to keep him warm, and he could literally fit in the palm of my hand, and it was scary.
He was so small. His skin was transparent. His fingers were almost like webbed still. The NICU was a musical. There were people all the time. It was a lot of movement, but then there were moments where it was still and it was quiet, usually after a tragedy.
The advice I would give to fathers about having a premature son is find your inner strength and your inner peace and just push on.
I had first learned about March of Dimes maybe about a week into being into the NICU. There were several volunteers who were walking through the hospital providing support for families, and one of the volunteers introduced me to the March of Dimes app. Being in this situation, I know what is required, but I don't have access to the resources or the power. And so if I could appeal to others to support March of Dimes, then I am appealing to them to help mothers like me.
The day that Levi came home, I knew he would be a handful because he waited till Friday the 13th to come home. When I look into Levi's eyes, I see hope, because through this situation when I didn't have hope, he had it.
18 years from now, I see Levi surrounded by friends. I think that he'll be the kind of person to lead people from tragedy to triumph, who lets people know that miracles can happen.
Thank you, Ariel and Marcus. Tommy and I know exactly what you went through. Our girls, Lena and Mia, were born early at 35 weeks and weighing just 4.5 pounds each. They spent a month in the NICU before they were allowed to come home. We all must do more so that no other family has to experience what ours has. We need to enable scientists to better understand preterm birth, get the best information to pregnant women and healthcare professionals, and follow up with the right preventions, interventions, and solutions to save families the heartache and stress of complications during pregnancy and preterm birth. We need to add our voices to advocate and prioritize legislation that has the potential to improve the lives of moms and babies and their families across the country.
Ari, Marcus, Andrea, and Tommy, thank you so much for sharing your story. Now it's time for all of us here tonight to join the fight against prematurity. This year's Ambassador Baby Levy is ready. Are you?
With your help, we can and we will create a world in which every baby has the opportunity to thrive and every family has the best possible start. We want to take a moment to recognize Felipe and Sedalia Burdon, who are our first Connecticut Feeding Motherhood $5,000 contributors. They have asked me to issue a challenge to all of you to match their giving by raising another $5,000 tonight. Help us meet this challenge. Fight with us. Fight for moms and babies everywhere.
I can think of no greater cause than fighting for healthy moms and strong babies, and to help March of Dimes continue support of cutting-edge research. At 6 March of Dimes Prematurity Research Centers, teams of brilliant minds from a range of disciplines look for answers and share discoveries to transform our understanding of preterm birth, including causes and preventions. 2,400 nurses received in-person professional training across the U.S. and right here in Connecticut at Trinity Health and Bridgeport Hospitals. Thank you, Dr. Murawski, for your $1,000 contribution. What an amazing start. Let's keep this generosity alive. Thank you to John Henry Archer for your $500 gift. Mary Renstrom, thank you for stepping up tonight too with your $750 gift. And no gift is too small. All gifts will help March of Dimes provide resources and programs that help moms before, during, and after pregnancy, even when everything doesn't go according to plan. Before we move on, I would like to show you the impact of your dollars right here in Connecticut.
COVID-19 is what you might call an equal opportunity infectious disease. If you get exposed, you will probably get infected. But it's become clear that just as not all patients with the disease are affected equally, some communities are also being hit harder than others.
There's a number of things that have been recommended, such as physical distancing, sheltering in place, and all of those sorts of things. But for marginalized populations, it's much harder to do that. You might have to take public transportation to get groceries and then to bring that food back home. And at each step along the way, there's an elevated risk of coming into contact with other individuals.
The mission is to reach out to those who are underserved, uninsured, that feel more connected if we go out to them in the community and can deal with their care on an individual basis.
We're out here just trying to get closer to their homes, just to make it easier for them to come to their daily appointments.
And if you can bring the services to where people are and to do the work out in the community, it will actually reduce the transmission broadly.
The Community Health Caravan started in 1993 to combat infectious diseases like HIV and hepatitis, and provides a variety of services from needle exchange to mental health counseling.
One of the things about such mobile medical clinics is they can rapidly respond as the community needs respond. One of the things that emerged was that there was a great need within the community to really deal with the unmet needs of newborn mothers and their children. And unfortunately, you can't weigh a baby through virtual, telehealth. And so you also can't measure their bilirubin and all the other postpartum complications.
I got involved with the Community Health Caravan early in the pandemic. I was looking for a way to see babies in the community.
Mothers didn't want to bring a new baby into a crowded office or into a crowded clinic. So the Department of Pediatrics reached out for us to ask if we could remission the van for a little new purpose. So we see only an individual mother and baby on the van and check out the mother and the baby.
So our goal is to, drive the van to these high-risk areas, and, we're dispensing masks, not only for the mothers, but for their families, their friends.
What this model does is allow a more low contact exposure way for families to access this care.
Due to the COVID-19 pandemic, the Community Health Van can't see the normal number of patients in person, but community outreach continues to help people get the supplies they need.
We're out here our main goal is to distribute as many masks as we can and educate people.
We do outreach.
We all give it masks. We bring needle supplies, syringe, Narcans, and we go to every part in Connecticut. But the overall mission about everything that we do is to keep people safe.
We do telephone visits. We also provide mental health counseling with our psychiatric nurse practitioner and our social worker and substance abuse counselors.
I came to New Haven in 1973. This is my people. This is the people that I grew up with. This is friends, people that I know. So, I want to help everybody, but, I want to help my community.
This is not only about providing care to people who need care and might avoid seeking that care, but this is about doing our part in a small way, one piece of the puzzle, to decrease community spread of coronavirus.
Hi everyone, I'm Gretchen Carlson. Soft pretzels, dipped in honey, sauerkraut, peanut butter, lime juice. That's what I craved when I was pregnant. But for women becoming pregnant today, they're craving more than just what's in the fridge behind me here. They're craving better health care. Here's a fact you may not know. Did you know the U.S. remains among the most dangerous developed nations for childbirth? The COVID-19 pandemic is making it, of course, even more unsafe. Well, that's why I'm supporting the March of Dimes signature chefs, Feeding Motherhood, to fuel change and ensure all pregnant women have access to care, address inequity in maternal health, and strengthen moms, babies, and families all across America. I hope you will join us as we partner with world-class chefs, yes, world-class, to create dishes that are inspired by families impacted by the inspiring work of the March of Dimes. Every recipe you're going to learn, dish you order, event you take part in, you'll be feeding motherhood and helping moms and babies in your community be healthier and stronger. So as a longtime supporter of March of Dimes and member of the National Board of Trustees, I want to personally thank you for joining this very important event. And to all of you who have already pledged to tonight's event, thank you so very much. If you haven't already made a donation, please consider joining me and countless others right now. There has never been a more important time to show your support for moms and babies.
Thanks to our ambassador family, volunteers, and sponsors. Thanks to the Connecticut Market Board and staff for all of their hard work and effort. Thank you to the hundreds of families that participated in the March for Babies Step Up virtual walk last spring. We can't thank you all enough for coming together in this virtual way when moms and babies need us the most. One last reminder that the online auction will remain open until 9 p.m. tonight, so make sure you get in your bid. March of Dimes staff will be in touch with the winners. Now to close our event, a final word from March of Dimes President, Stacy Stewart.
Thank you for joining us and for your continued support in our mission to fight for the health of all moms and all babies. As we find our nation in the midst of COVID-19, the importance of what we do is more critical than ever. With your help, we're advocating for policies to protect them, working to radically improve the healthcare they receive, pioneering research to find solutions, and empowering families with the knowledge and tools to have healthier pregnancies. And by going virtual with our programs and easily available online resources, including marchofdimes.org and itstartswithmom.org, we're meeting families wherever they are. The March of Dimes community is made up of thousands of incredible people just like you who are dedicated to do better for moms, dads, and babies everywhere. Together, we can build a world where every family is healthy and strong today and for generations to come.